Hello guys, welcome to Healthcare Engineering YouTube channel. On our channel, we share many informative videos all about healthcare industry. Subscribe to our channel to keep yourself updated. Also share our videos and channel with all your healthcare contacts. Like our videos and let us know your valuable comments to show us your supports. Today we are going to share you some very useful information which should be known by all healthcare professionals. Medical laboratory plays a vital role in all healthcare setups. We are going to share you important medical laboratory tests. We deal in medical laboratory labs. This is the part 2 video for our previous common medical laboratory test video. Stay tuned with us by subscribing our channel to get the all notification. Now let's go through some important common medical laboratory tests. What is the difference between clotting time and bleeding time test? Bleed time test helps identify any disorder associated with the functioning of the platelets. Clotting time is the measure of the time taken in the formation of a clot after the bleeding has started. The normal bleeding time is between 2 to 7 minutes. The normal clotting time in a person is between 8 to 15 minutes. Bleeding time is a medical test that measures how fast small blood vessels in the skin stop bleeding. What are the three stages of blood clotting? Constriction of the blood vessel, formation of a temporary platelet plug, activation of the coagulation cascade. What factors affect bleeding time? Numbers of platelet and platelet function, white and red blood cell counts, vascular factors, hormones, and temperature. Which deficiency increases clotting time? Calcium plays a very important role in the blood clotting. Intrauterine insemination. A type of artificial insemination is a procedure for treating infertility. What is success rate of IUI on first try? For a healthy fertile couple, the chances of getting pregnant naturally are about 20%. What is normal egg size for IUI? Patients with follicular size between 14 and 22 micrometer had the positive outcome. What is the prothrombin time test? A prothrombin time test measures how long it takes for a clot to form in a blood sample. What is the treatment for high prothrombin time? Increase or decrease oral vitamin K administration. What causes high prothrombin time? Illness, change in diet, and some medications. What is the danger level for INR? Above 4.9 are considered critical values and increases the risk of bleeding. What is the normal prothrombin time level? However, in most laboratories, the normal range for prothrombin time is 10 to 13 seconds. What is serum alkaline phosphatase level? An alkaline phosphatase level test measures the amount of alkaline phosphatase enzyme in a bloodstream. What happens when alkaline phosphatase is high? If alkaline phosphatase levels are high and the results of liver test are normal, the problem may be a bone disorder such as Paget's disease of bone. What is normal range alkaline phosphatase by age? ALP results are reported unit per liter for men and women older than age 18. An ALP level between 14 and 147 units per liter is considered normal. What is serum bilirubin direct test? This test looks for bilirubin in your blood or urine. What causes high direct bilirubin? The conjugated bilirubin level is often elevated by alcohol, infectious hepatitis, drug reactions, and autoimmune disorders. Why is serum bilirubin test done? It's used to help find the cause of health conditions like jaundice, anemia, and liver disease. An estradiol test measures the amount of the hormone estradiol in your blood. It's also called an E2 test. What might affect test result? Taking birth control pills or hormone therapy may affect the result. How to get ready for this test? You don't need to prepare for this test. be sure your healthcare provider knows about all medicines, herbs, vitamins, and supplements you are taking. This includes medicine that don't need a prescription and any illegal drugs you may use. Why do you need this test? You may need this test if your healthcare provider thinks you have problems caused by high or low levels of E3. These problems include menstrual problems, ovarian tumors, menopausal symptoms, breast cancer. Prostate specific antigen test. Prostate specific antigen test is a protein produced by normal as well as malignant cells of prostate gland. The prostate specific antigen test measures the level of prostate specific antigen in the blood. What causes prostate specific antigen levels to rise? For example, the prostate specific antigen level tend to increase with age, prostate gland size, and inflammation or infection. What is the normal range for prostate specific antigen levels? The normal range is between 1.0 and 1.9 nanograms per milliliter. Ferritin test. A ferritin blood test is used to help check your iron levels. It can help your healthcare provider find out if your body is storing the right amount of iron to stay healthy. What happens if ferritin is high? If a ferritin test shows higher than normal levels, it could indication that you have a condition that causes your body to store too much iron. What disease causes low ferritin? It also happens in Crohn's disease, ulcerative colitis, and celiac disease, and hematuria, peptic ulcer. What organ produces ferritin? It is mainly synthesized in the liver. What is an ionized calcium? Ionized calcium is calcium in your blood that is not attached to proteins. It is also called free calcium. All cells need calcium in order to work. Calcium helps build strong bone and teeth. It is important for heart function. What is normal ionized calcium? The normal range of ionized calcium is 4.65 to 5.25 milligram per deciliter. What happens if ionized calcium is high? Excess calcium makes your kidneys work hard to filter it. This can cause excessive thirst and frequent urination. Serum phosphorus test. What is serum phosphorus test for? Phosphorus is a mineral the body needs to build strong bones and teeth. It is also important for nerve signaling and muscle contraction. This test is ordered to see how much phosphorus is in your blood. Kidney, liver, and certain bone disease can cause abnormal phosphorus levels. What happens when phosphorus levels are high? Extra phosphorus causes body changes that pull calcium out of your bones, making them weak. What is a normal serum phosphorus level? The normal serum phosphorus concentration is 3.4 to 4.5 mg per deciliter. What are blood cultures test for? A blood culture is the laboratory test to check for bacteria or other germs in blood sample. What bacteria is found in blood cultures? Coagulase negative staphylococcus. How long do blood cultures take? It usually takes between 1 and 3 days to get the results of blood culture. What does a negative blood culture mean? A positive results mean bacteria or yeast are present in your blood. A negative results mean that no signs of any bacteria or yeast were found in the blood. Result of a blood culture test. Negative or normal blood culture result indicate that there is no presence of bacteria or fungus in your bloodstream. What is serum creatinine test for? A creatinine test is used to see if your kidneys are working normally. What is a serious creatinine level? A creatinine level of greater than 1.2 for women and greater than 1.4 for men. What happens if serum creatinine is high? High creatinine level usually indicate that the kidneys are not working as they should. Possible causes of this dysfunction include a kidney infection. What are the symptoms of increased creatinine? There are symptoms associated with a high creatinine level: swelling, feeling tired, changes in how often you urinate, loss of appetite, nausea, itching. Electrolyte test. What are the 5 serum electrolytes? The major electrolytes in the body are potassium, magnesium, calcium, sodium, and chloride. What happens if electrolytes are low or high? When the amount of electrolytes in your body is too high or too low, you can develop dizziness, cramps, irregular heartbeat. What does serum electrolyte test for? An electrolyte panel, also known as serum electrolyte test, is a blood test that measures level of body's main electrolyte, sodium, which helps control the amount of fluid in the body. It also helps your nerves and muscles work properly. Chloride, which also helps control the amount of fluid in the body. What is a hematocrit test for? Hematocrit is a blood test that measures how much of person's blood is made up of red blood cells. These measurements depend on the number of and size of the red blood cells. Blood transports oxygen and nutrients to body tissue and returns waste and carbon dioxide. What does a high hematocrit mean? A higher than normal hematocrit can indicate dehydration, a disorder such as polycythemia vera that causes your body to produce too many red blood cells, lung or heart disease. What does it mean if your hematocrit is low? A hematocrit level below the normal range, meaning the person has too few red blood cells, is called anemia. A hematocrit level above the normal range, meaning too many red blood cells, may indicate polycythemia or erythrocytosis. Semen analysis. What are the tests done on seminal fluid? A semen analysis is a lab test that evaluates sperm count, motility, morphology, and more. How to prepare for a sperm test? How to prepare for the test? In order to have adequate sperm count, do not have any sexual activity that causes ejaculation for 2 to 3 days before the test. How much sperm is required for sperm analysis? They will not how much semen you were able to provide for your sample. A normal amount is at least 1.5 milliliters. Thank you for watching our video. Check the I button above for new release of next part. Subscribing our channel, stay tuned.